Hi everyone, Dr. Emmy from Pain Free and Fit. Today, probably the most important lower back disc exercise you'll ever learn. Hope you enjoy. So to clarify, the reason I call this the most important lower back disc exercise is because of all the hundreds of videos I've published on the channel and the many disc patients I've treated both in my office in the clinic and online over the last 35 years. Probably one exercise that everyone needs to know about is a postural exercise. And that exercise is specifically for those of us who have a posterior or backwards located disc herniation in the lower back. That's the vast majority of lower back disc herniations. Remember that when we have a forward posture, meaning we're slumping down or we're bending over to pick something up, or we've repeatedly done leg raises or forward motions on the spine, where we haven't balanced that motion with equal extension or backwards motions, the disc starts to get compressed in its front or anterior section, and it causes the fluid or the nucleus in the disc to start migrating back through cracks or tears in the disc until it creates a bulge or herniation into the back wall. Remember, the disc only has nerve supply in its peripheral fibers, so you don't feel anything until that pressure builds up and starts pressurizing that back wall. Remember, this exercise is not to make up for all the hundreds of other ones that need to be tailor-fitted for your biomechanics to take pressure off the disc, to help you stabilize your spine. But if you only had to whittle it down to one exercise, this would be it. And it's a postural exercise that decreases that forward bend on the spine. And all it is locating the bottom of your ribs in the front. You go to your abdomen, you'll feel your rib cage has an angle to it, and it comes down that very edge. And problems arise when that angle falls down. This not only happens when we sit and when we bend and when we move, but it also happens when we stand, when we walk, when we're talking to someone. So the exercise is simply learning to keep the front of that rib cage up and backwards. You notice that small movement that I made from a typical forward slumped posture to ribs up and backwards. And when you do this, the muscles in your back, in your mid-back, in the top of your lower back, the extensors will tighten. And if you're not used to this, try to hold this position for any length of time. You'll notice that those muscles are working hard. So I encourage you to start practicing this a little at a time. Give your body a chance to break in over several weeks or several months until you can hold it most of the time. When you go to pick something up, simply think rib cage up, the front of the rib cage up and back, and maintain that as you squat, let's say from the hip to bend, as opposed to crunching down as you bend. If you're using a lunge maneuver to pick something up with one leg back and one leg forward, same thing. You want your rib cage to be positioned up and back to a tolerable degree. Again, if you go back too far and feel irritation in your lower back, that's too much of a change of what's known as your neutral spine or neutral lordosis. So as you maintain that up, you're going to again drop the hips back. And I haven't changed that distance between my pubic bone and my rib cage. Once I've set that up, that stays the same as I bend with a lunge or with a squat, or with even a simple hip hinge if my knees are straight and I'm just rotating from the hips. It's the same principle. I want to keep that rib cage up away from the front of my pelvis, away from the pubic bone. As I walk, I'm going to try to use that same technique where I'm taking my ribs, bringing them up and back, and holding them at a comfortable degree as I walk. When I sit down, I want to especially make sure that those ribs are up and back. Because the longer you sit, the longer you drive, the longer you're on your phone or your computer, the rib cage is going to want to drop. And remember, with disc problems, the vast majority of them are not from one automobile accident, one slip or fall. They're a cumulative stress that's happened from too much flexion, meaning that the front of those ribs have dropped down for too long, over days, weeks, and months, and that pressure is built up, encouraging that nucleus to migrate backwards or posterior, creating tears in the disc, creating that pressure that eventually feels pain. So this can not only serve you well if you're having an acute disc herniation and you're in a lot of pain. Try elevating those ribs and get to the point where how much rib up feels the best on my back. That's what you need to work on. That's your neutral position of rib cage alignment to reduce that pressure on your disc. And then as you get out of your pain, you want to continue practicing that as you bend, as you move, as you're standing still, as you're sitting prolonged. The more you do this, the more you're going to realize your lower back posterior disc herniations are going to bother you a lot less. This entails not only acute disc herniations, but chronic degenerative disc disease. Disc problems need to avoid, for the majority of them, a anterior compression. So keeping that rib cage up, building up the length of time that you hold it, not necessarily how far back you go, but how long you can hold that position is the exercise, and over time you build that up and be quite pleased in reducing that forward irritation on your disc. Now, be aware that if those of you have, let's say, an anterior disc herniation from too much pressure backwards, this exercise is not suited for you. You need the opposite. We cover those in different videos. And also keep in mind that to really make sure that you can maintain that position as well as maintain any problems that you have with rotation or twisting that affect the disc, or sideways tilting habits of your rib cage, or asymmetrical muscle imbalances that cause one hip to come up or hip hike, these have to be addressed with different exercises so you can learn a tailored approach to keeping yourself in a full neutral spine position, not only from a front to back position, but a side to side rotation, as well as a translation. Sometimes people have problems translating their rib cage or their pelvis side to side or front to back, like sway posture. So there's a lot more to protecting your disc, and we cover all these in the Fast Track program for degenerative disc disease, available at painfreeandfit.com. But working on this one simple, most important exercise for posterior disc herniations by keeping the ribs up will help you get started. And if you only do one, this is the one that you could focus on. I hope you have enjoyed this video on low back disc herniation, the most important exercise. And remember, if you have questions or comments, write in. I'll do my best to answer them. Give me a thumbs up to share this valuable information with others. And search out a tailored approach either with a rehab specialist or through our many programs at painfreeandfit.com to give yourself a balanced exercise program, not just one simple one, to really increase your chances of avoiding low back pain due to disc problems.